SCV Community Health Resource Center. This week, Rick sat down with Randall Kaiden of Kaiden Elder Law Group. They talked about how the elections may be affecting Medicare and Medicaid for seniors and what you should be doing to plan ahead.
So I'm here with Randall Kaiden at Kaiden Elder Law. So thanks, Randall. Thanks for letting me come over and pick your brain a little bit.
Thanks for having me.
And we have just gone through, and we're not going to get political, but we've just gone through an election.
Yes.
And obviously, in any situation like this, things change all over the place, across the board. But
Absolutely.
in terms of Medicare, Medicaid, or Medi-Cal in California, and the whole environment, and you being an elder law, understanding what we're doing today and what things are happening today, what kind of changes do you expect? We have a Republican now in the White House with both sides of Congress being Republican as well. What are some of the things you're anticipating changing, and what should people be thinking about?
Yeah, I think that's really a great question. We even before this election happened, we know that 10,000 people a day are turning 65. We're in this 20-year run, and everybody is always hearing about how Social Security is running out of money and Medicare is running out of money, and America is so leveraged up. And here you have a completely Republican government. So there's some things that we can probably anticipate, such as maybe the estate tax and gift tax will be gone. Maybe Trump is going to get rid of that. Also, the Affordable Care Act, maybe that's going to be gone. And maybe taxes are going to be lowered as well, right?
Okay.
And so the question that I have is, we already have this enormous $1 trillion debt. And if we're lowering taxes and we have less revenue coming into the government, it's not going to be a shock that more and more benefits are going to be stripped out, whether it be Medicare or Medicaid in California, which is Medi-Cal. It's the California version of Medicaid. We could see a future where less and less is being offered to seniors to help them. And in that future, I think there's even a larger requirement. There's already a huge requirement for people to plan ahead and deal with all their life care planning issues. How are they going to live in the least restrictive environment, not run out of money, have to rely on others to help them, all the fears that we know that seniors have. Well, in some ways, I think the environment just got even more scary.
Yeah, we see a lot of times where families looking at this whole situation, care, things like that, and I don't know, there's a whole bunch of reasons for it, but we didn't think of this, or we didn't consider this. This is just, we hear it all the time, and it's universal almost, and it's almost as, in addition, length of time, not just like this. Yeah, of course, I've considered that maybe mom and dad would get sick and be in the hospital for some time, or in a skilled nursing facility for a short period of time, acute period of time. But these years and years and years that we need care, no, that didn't register. So what you're saying, if kind of throwing it back at you, is that might change a little, even the calculations and the thought process before.
Yeah, so the latest statistics that I've read is that the average lifespan of an American woman is now 88, and for a man it's 86. And so
the average.
Yeah,
right.
Right, and so we have this blessing. Medical science is getting better and better, and people are living longer and longer. But with that, we have all these difficult questions to address. Somebody gets dementia, Alzheimer's. How are they going to get care? And we know that the care costs are rising much faster than inflation. And the question is how are people going to get the care? How are they going to afford the care? And the government, it looks like, is not going to have the money to be providing these safety nets for people. So to me, it seems more so than ever, people really want to engage in pre-planning to make sure that they can live in the least restrictive environment, which generally means their house, and really figure out how to utilize their resources along with, if they're veterans aid and attendance pension benefits, the Medicaid system, and even long-term care insurance. I know a lot of people have had an aversion towards long-term care insurance, but I think in the future, it's going to be really a key element to planning. You know, the policies are getting better. They got these hybrid policies out there, and if you don't use it for one thing, it can be used for another thing, like life insurance. If you don't use it for long-term care, it turns into a life insurance policy. So I think that in the future, we're going to see more and more of a call for this, and people are going to have to, unfortunately, rely on themselves, and they can't rely on the government to help provide that care.
People are on their own a lot already, and not necessarily having that as an expectation. They're surprised. Oh, you know, I mean, a lot of the calls that I get, okay, that's great, we can do this, we can do a home care, we can supply a caregiver. Okay, so who pays for this? You know, unless you have long-term care insurance or veterans benefits or something, unfortunately, the hard answer is, no, it's coming out for you. I mean, it's coming out of your pocket, and that's where the surprise is. So it's sort of, we're on our own, didn't realize we're on our own. Are you saying that that's not only going to continue, but might be exacerbated a bit?
I anticipate it's not only going to be exacerbated, it's a foregone conclusion. We have only so many resources. You know, we're only taxing a certain amount. You know, we have more and more people getting older. The population is aging. Where's the money going to come from? Already, I think with a lot of states, Congress has come out with what's called block grants, where they're saying, we're just going to give you, the state, like New York or California, we're just going to give you X amount of dollars, and you guys deal with it. And of course, once you do that, you know, what's the state going to do? I mean, California has had its issues, and you just, fiscally, I don't know if there's going to be enough money. We're going to start to see really capitated rates. They might say, okay, you know, in the most dire of circumstances, we'll give you $2,000 a month to help. But in reality, the cost of the care is maybe $10,000 or $15,000 a month. What are people going to do? And so I think it's really wise to anticipate these kinds of questions right now and plan ahead, you know?
So while we're looking at this sort of out in the future and based on our recent election, and obviously we're just estimating things here, but you could kind of see based on even past what's going on here. When people are in this situation now today, I mean, what's the first thing they should be doing? You know, okay, this is dire, it's not dire, but you know, this is tough kind of questions, tough things to think about. Okay, what is the solution? And I know we don't have time to go through the entire thing. Although, if it was that easy, we wouldn't need elder law, right? But the point is what's the first thing? Okay, what's the first step? Okay, I sit down. I'm going to tackle this. What should somebody be thinking about?
Well, you and I have spoken before, and you know my mantra is that estate planning is not enough. You know, when we're talking about estate planning, we're talking about living trust, powers of attorney. We're really addressing the question of what happens if I die and what happens if I become incapacitated. And I get a lot of people that come in and they see me once mom or dad is already in skilled nursing care or in assisted living and memory care, and they can't change anything.
There's not much you can do, right?
And they didn't realize. They thought that they thought they had Social Security, with Social Security, Medicare, and their estate planning. They thought they were covered.
It's done.
But they're shocked. Their family is shocked to realize that that is absolutely not true. We're just talking about a small sliver of the elder care continuum, the very end. You know, everybody starts at home, healthy, and then maybe they need a few hours of help, and then they might need to move along, and they move along that care continuum into maybe independent living, assisted living, board and care facilities.
It's a long period of time. We're not talking months here. We're talking years. And hundreds of thousands, if not millions of dollars potentially in cost. And so, you know, with estate planning, we're just looking at that very end sliver. What about life for the seniors, and how are they going to get the most out of life and live life the way they want to live without becoming a burden on their family? And I think that really every senior really could help them to go and meet with an elder law attorney and discuss these issues. When we address them, we're addressing them from 4 different standpoints. We're working backwards. So we know when a person, the first issue is their health care. So just like the old saying goes, when you have your health, you have everything. But as soon as your health starts to go, the health turns into a housing issue. Right. And then once we're in a housing issue,
we know that that becomes a financial issue because it's really expensive. And then once we're in the housing and financial issue, that turns into an elder law legal issue. So from our perspective, we want to look at the full breadth of planning and start at the beginning and say, well, maybe we can get in a geriatric physician to run tests once a year to maybe stave off certain conditions for as long as possible. Maybe we can do things in the house that will prevent a fall or certain injuries that will keep a person healthier longer in their home so that we don't cascade into these other issues, the housing, the financial, the elder law. We know we're going to eventually need to do that anyhow, but if we can hold off for an extra 5 or 10 years, that could translate into hundreds of thousands of dollars.
Yeah,
So,
and this kind of planning doesn't matter. This isn't like just for millionaires. In fact, this is for everyday people, right?
yeah, it's
me and you. This isn't for the big guys that have millions and millions of dollars. This is for those who are just normal everyday people, middle class, anything,
right.
where they need to look at that kind of planning because it doesn't matter. That's an issue, but those people in those different sets also would be somebody that we look at elder care, correct?
Yeah, elder law care, or elder care law, really, to differentiate it from, let's say, elder abuse. A lot of people don't even really know what elder law is.
Well, they think of it in terms of law, things like abuse and fraud and stuff like that, where it's explain it more. Yeah, people get confused.
Frankly, I have a lot of estate planning attorneys who pull me aside and they say, what is it that you do again? They're not exactly sure, what is elder law. And, when we're talking about elder law, we're talking about the full breadth of issues that elders deal with, and elder abuse might be one of them. But, that's maybe affects less people versus elder care law is affecting all seniors. All seniors. And, great, if you have $10 million, you can afford to self-fund whatever's going to come up. And so maybe your beneficiaries, your children, grandchildren, they inherit less. It's not the end of the world. But it's really critical for those couples who have, let's say, less than a couple $1 million, or if you're single and you have $1 million or less, because I think the distinct possibility exists that a lot of these people are going to wind up going bankrupt as they get older. If you had planned ahead and wisely, if you're able to get that aid and attendance pension benefit of an extra couple $1,000s a month, well, over time, that can translate into a lot of care and a lot of money. Same with Medi-Cal or 1915C waiver programs when you get home-based care. It can be, very significant.
Sure, yeah,
so
absolutely.
I think it behooves all seniors to at least speak with an elder law attorney about the possibilities of what's out there for them. What can they do to live in the best possible manner for the remainder of their life, and not just be focused on estate planning. What's going to happen when I die? I mean, we all know we're going to pass away, and we know we need to address those questions. But for me, it's far more important to address the question: if I'm a senior, how am I going to live? How am I not going to become a burden on my family? And who's going to be there to help me? And how am I going to make it through? All these kinds of questions.
Great advice. Good stuff. Well, thank you very much.
You're welcome.
Appreciate you. And
Anytime.
That's Randall Kaiden from Kaiden Elder Law. Thanks again.
Anytime.
Today. If you need more information on elder care planning, please contact Randall Kaiden at 661-247-8433 or www.kaidenelderlaw.com. Upcoming events in the Santa Clarita for next week are Monday the 14th at Oakmont, Q&A exploring answers to questions about Alzheimer's and dementia from 6:30 to 8 p.m. Wednesday the 16th, the Senior Center is hosting a scholar series, The Puritans, from 10 to 11 a.m. On Thursday the 17th, the Senior Center has legal services going on from 1 to 2 p.m. On Friday the 18th, Atria is hosting everyone's favorite Trader Joe's Fall Collection wine tasting from 1:30 p.m. Here at the SCV Community Health Resource Center, we have all sorts going on. On the 14th at 12 noon, Safety Staff will be presenting American Heart Association Stroke Prevention and Life's Simple 7. Wednesday the 16th at 2 p.m., Carolyn from Kidney Quest will be presenting Identifying Kidney Disorders, followed by a support group for those with chronic kidney disease. On Thursday the 17th at 10 a.m., we'll be having Susie Fox facilitating the Alzheimer's Caregiver Support Group, while Azam Irilian and I will be facilitating Art for Alzheimer's at the same time. These groups will be for both the caregivers and those suffering with Alzheimer's and dementia. Please feel free to call the SCV Community Health Resource Center at 1-800-808-4777 with any questions, or you can email us at SCVCHRC@homecaresantaclarita.com. Thanks, and we'll see you next week.